I can provide you with some general information about signs that may indicate high blood sugar levels and common symptoms of diabetes. It's important to note that these signs and symptoms can vary from person to person, and a proper diagnosis should always be made by a healthcare professional. Here are some common signs and symptoms to watch out for. Signs of high blood sugar. 1. Increased thirst. 2. Frequent urination. 3. Fatigue. 4. Blurred vision. 5. Slow healing wounds. 6. Increased hunger. 7. Dry mouth. 8. Headaches. 9. Nausea and vomiting. 10. Skin problems like itching or infections. 11. Difficulty concentrating. 12. Numbness or tingling in hands and feet. 13. Weight loss despite increased appetite. 14. Recurrent infections, such as yeast infections. 15. Mood swings. 16. Dizziness. Common symptoms of diabetes. 1. Increased thirst and urination. 2. Fatigue. 3. Unexplained weight loss. 4. Increased hunger. 5. Blurred vision. 6. Numbness or tingling in the hands or feet. 7. Slow healing wounds. 8. Skin problems, such as dry skin or itching. If you are experiencing any of these signs or symptoms, it is important to consult a healthcare professional for proper evaluation and diagnosis. Managing blood sugar levels is crucial for overall health and well-being, especially for individuals with diabetes or at risk for developing the condition. Frequent urination. Frequent urination, medically known as urinary frequency, is the need to urinate more often than usual. While the number of times a person urinates can vary, urinating more than 8 times a day is generally considered frequent urination. Several factors can contribute to frequent urination, including increased fluid intake. Drinking large amounts of fluids, such as water, coffee, or tea, can naturally lead to more frequent urination. Medications. Certain medications, such as diuretics, can increase urine production. Medical conditions. Several medical conditions can cause frequent urination, including urinary tract infections (UTIs), diabetes, interstitial cystitis, bladder pain syndrome, and prostate problems in men. Pregnancy. During pregnancy, the growing uterus puts pressure on the bladder, which can increase urination frequency. You are concerned about frequent urination. It is important to consult a healthcare professional to determine the underlying cause and get appropriate treatment. Fatigue is a feeling of tiredness or lack of energy that can interfere with daily activities. It's a common symptom that can have various causes, including lifestyle factors. Lack of sleep, poor diet, physical inactivity, and stress are common contributors to fatigue. Medical conditions. Several medical conditions, such as anemia, thyroid disorders, chronic illnesses, and infections, can cause fatigue. Medications. Certain medications can cause fatigue as a side effect. If you're experiencing fatigue, it's important to consult a healthcare professional to identify the underlying cause and get appropriate treatment. Blurred vision. Based on the symptoms described, the nurse may consider these findings as indicative of hypertension. Hypertension can cause headaches, blurred vision, weakness, and edema. It can also lead to nocturia and fainting or dizziness in severe cases. Hypovolemic shock would present with symptoms such as rapid heartbeat, low blood pressure, and decreased urine output. Endocarditis may cause fever, fatigue, and shortness of breath. Ventricular tachycardia would present with a rapid heartbeat and palpitations. Slow healing wounds. Certainly, diabetes mellitus is a group of metabolic disorders characterized by high blood sugar levels, hyperglycemia. The most common types are type 1 and type 2 diabetes. Type 1 diabetes is an autoimmune disease where the immune system attacks and destroys insulin-producing beta cells in the pancreas, leading to an absolute insulin deficiency. Symptoms include excessive thirst, frequent urination, weight loss, and require lifelong insulin therapy. In contrast, type 2 diabetes is primarily characterized by insulin resistance and relative insulin deficiency, often influenced by genetics, obesity, and lifestyle factors. Symptoms are similar, but often milder, and management involves lifestyle changes, oral medications, and, in some cases, insulin. Personalized care and regular healthcare provider monitoring are crucial in diabetes management to prevent complications. References: American Diabetes Association. 2022, Standards of Medical Care in Diabetes, 2022. Diabetes Care, 45 Supplement 1, S1S to 61. Increased hunger. External rewards or incentives. These rewards can come in the form of praise, money, social status, or other desired outcomes. Incentive theory suggests that people are motivated by the anticipation of reward or punishment for their behavior. For example, if a student is motivated to study for a test because they know they will get a good grade, and their parents will reward them, this is an example of incentive. Motivation. Overall, there are various approaches to motivation, and each one offers a unique perspective on what drives human behavior. By understanding these different approaches, we can gain a deeper understanding of why people behave the way they do, and how we might be able to better motivate ourselves and others. Headaches. Here are a few remedies that may help alleviate tension headaches. 1. Relaxation techniques. Practice relaxation techniques like deep breathing, meditation, yoga, or stretching exercises to reduce stress and muscle tension. 2. Heat therapy. Apply a heat compress or take a hot bath or shower to relax your muscles and ease tension in your head and neck. 3. Massage therapy. Gentle massage on the temples, neck, and shoulders can help relieve tension headaches. 4. Over-the-counter pain relievers. Taking over-the-counter pain relievers like acetaminophen, ibuprofen, or aspirin can help ease the pain. 5. Hydration. Drink plenty of water to keep your body hydrated. Dehydration can cause tension, headaches. 6. Avoid triggers. Avoid triggers like caffeine, alcohol, and processed foods, which can trigger headaches. If your headaches persist or become more frequent, it is best to consult a healthcare professional.